Good. Hi, everybody, and welcome to today's webinar by Rutgers University. And it's entitled Self-Management and Recovery Training, or something that we refer to in New Jersey as Smart Recovery. We're happy to bring you this information today and hoping that you'll find it as a new, well, it's not new, but it's new to many of us, alternative to the traditional 12-step approach to helping people recover from substance and process dependencies. I'm joined today, my name is Dawn Reinhardt Wood, and I'm joined today by my colleague Jennifer Sperduto, and we'll just be kind of splitting up the presentation today. And we are from Rutgers University in New Jersey, School of Health Professions, Department of Psychiatric Rehabilitation and Counseling Professions. Next slide. Next slide, I'm sorry. So again, welcome. Today's webinar is hosted by DBHR through the Washington State Healthcare Authority. This is an interactive training, and we encourage you to ask questions and participate throughout this session. The slides, as well as a link to the recording of this webinar, will be sent by email after the presentation. Next slide, please. This is me, but a different hair color. I swear it's me. So I am with Rutgers Department of Psychiatric Rehabilitation and Counseling Professions, and both Jen and I work on a team of consultants that implement evidence-based practices in New Jersey's state psychiatric hospitals. Prior to that, I worked in community mental health, specifically or mostly in supportive housing and homeless outreach and case management services with some crisis work thrown in there. Next slide. And my colleague, Jennifer Sperduto, also a long timer in the mental health community, prior to her work in our Institute for Inpatient Psychiatric Rehabilitation, formerly known as the SPRE Project. She worked in various community settings, including clubhouse models, vocational rehab program, and housing programs. Next slide, please. So what we hope that you'll take away today are these four main points. So today we're going to be talking about this thing called smart recovery. So we're hoping that by the end of the webinar, you'll be able to differentiate and describe smart recovery as an approach to address substance dependence and other dependence disorders. You'll be able to, again, like I said, differentiate between this approach called smart recovery and a traditional 12-step approach such as NA, AA, OA, SA, and the list goes on. To recognize the structure of what a smart meeting looks like, again, a different approach and with some different interventions than what you would see in a traditional 12-step type meeting. And to identify different facilitation tools and techniques that can be used within that smart recovery approach. So we'll actually be looking at some of the forms that are used. And I think you'll like what you see. And they can really be used within the context of this approach and also kind of as an adjunct to some other work that you might be doing specifically around goal planning and change planning. So this topic, I think, fits really well with some of our other conversations that we've had in previous months around substance and process dependence, and also around techniques like motivational interviewing, which you'll see some of that will be touched on in this approach. Next slide, please. And welcome everyone, as I see you pouring in and being so kind and greeting everyone. Welcome, greetings to you too. So Smart Recovery, or self-management and recovery training, is a global community of mutual support groups. So thinking about kind of the concept of NA, AA, and other traditional 12-step support groups that you may be familiar with, this has global reach and is used not only in New Jersey, not only within the United States, but in other countries as well, worldwide. At meetings, participants help one another resolve problems with any addiction or dependency. So drugs, alcohol, or certain, activities, or what we think of as process addictions, things like gambling, overeating, problematic sexual activity, and so on, other risky type behaviors that the individual is finding is impacting their functioning and ability to really fulfill their valued social roles or life roles that they prioritize for themselves. Participants find and develop the power within themselves to change and lead a fulfilling and balanced life, guided by a science-based and sensible 4-point program. So this program is rooted in science, is evidence-based, and is utilizing some previously researched techniques within the intervention. So when you think about, if you're familiar with other curriculum for addressing or helping people move along their path to recovery, whether it be psychiatric recovery, recovery from substance or process dependencies, something like IMR, illness management and recovery, which folks here may be familiar with because it's been around quite some time and is used in a lot of psychiatric and behavioral health settings to help people kind of increase their self-awareness of the condition that they're living with, and also steps that they can take to self-manage that and grow from that. Those packages of interventions use things like CBT, motivational interviewing, educational approaches that have already been proven to be effective scientifically. Smart Recovery is similar in that way, that it packages some of these other interventions in a way that kind of gets at and attacks like some of those main areas where people need to address their deficiencies and also strengthen some of their skill sets. Next slide. Thank you. So this slide is really just to kind of orient us to what we see in terms of some of the statistics around substance use or dependency disorders and recovery from such disorders. So approximately 23 million Americans actually meet the criteria for and this is specifically speaking about substance use disorders, for needing treatment for dependency. It's a lot of people, and we're talking ages 12 and up. So we're talking about adolescents, young adults, middle age on through geriatric. So that's a lot of people, but only 10% receive the treatment they need. And this is pretty consistent with what we see in terms of help-seeking behaviors, or that's okay, Deb, welcome. We're glad to have you here. Help-seeking behaviors, or actual accessing those treatments that individuals need, or services that they need for conditions that they're living with. So, for individuals who have mental health conditions or technically meet the criteria for a mental health disorder, the percentage of those individuals who actually seek care is much smaller than the amount that need the care. And there's a lot of reasons for this, stigma being one of them, accessibility to services, affordability of services, people having to balance, am I going to, I feel like I need this treatment for this dependency disorder or this mental health condition, but I also have to work, right? So there's a lot of factors why people may not be able to access treatment. There are, by contrast, if you look at healthcare issues, 85% of the 29 million people residing in the United States who have been diagnosed meet the diagnostic criteria for having one of the forms of diabetes 85% of those people receive treatment. So you could see this clear kind of dichotomy in how we think about and how accepting we are and how accessible treatment for substance use conditions and process addictions, as an offshoot of that, are, in contrast to other physical health conditions. And I think that is probably reflective of a lot of stigma. If anybody else has theories, feel free to posit them. But I think it has to do with access, the actual availability of the number of programs, and stigma, and probably being underinsured as well, or not insured. And as you see here, so 23.5 million people, adults over the age of 18, are in recovery from alcohol or drug use disorders. That's 1/10 of our population. 1/10 of our, that's a huge number of people. Most never receive the help that they need. So over the lifetime, only 11, that number, that 10% only creeps up 1.2% to 11.2% will receive the help that they need for their disorder from a specialized facility. So we see that this recovery from substance and process dependencies, here we're speaking more specifically about substance dependencies, is horrific, So some of the behavioral addictions that we may also see, so these are the things that we refer to when we talk about process disorders or process dependencies, things like pathological gambling. Pathological meaning it gets to the point where it's negatively affecting your life, right? You could go to Las Vegas, you could go to Atlantic City, you could go to Mohegan Sun, and I'm sorry, that's a local casino. You could have a great weekend and maybe you do that once a year and you're still able to pay your rent. You're still able to buy food, put food on the table for the kids, right? But pathological meaning it's hurting your relationships. You're unable to meet your financial obligations. You feel bad about it and so on. So when we talk about pathological, that's what we mean, the impact on the person's functioning and quality of life. So life for individuals who engage in pathological gambling, they also have a lifetime estimates of a substance dependency of 35 to 63%. And you'll see ranges all over the place because things like addiction and dependencies and some of these actual behaviors, problematic behaviors, also come with shame. And it's really hard to sometimes really put your finger on that hard and fast number. So this is where the estimates lie. Kleptomania, so this is compulsive stealing, 23 to 50%. Skin picking, which is also a behavior, a process, it can be treated as a process addiction, 38%. So these are co-occurring with substance dependencies, right? So when we're thinking about individuals that we work with, it's really important to understand that these individuals, if they have a substance dependency, they may also have some other behavioral process type addiction. So this is just to kind of raise that awareness, to keep your mind open and to ask about other maybe problematic behaviors that the individual may be engaged in that are affecting their lives negatively. Next slide, please. I'm sorry, I'm going to be sipping from my can of Coke Zero today. I'm very dried out. So let's look at the background of how groups like NA, AA, these mutual, what we call mutual self-help groups or mutual aid self-help groups, because that term means that, individuals join together with a common challenge. They're not only addressing their needs within the context of that group, but they're also helping each other because they're peers and folks are coming together with this shared experience where there can be a lot of interaction, learning from each other, mentoring each other. For those of you who are familiar with AA, NA, and those types of traditional 12-step programs, programs, you know that individuals seek out sponsors, which are really like mentors, right? So there is that kind of mutual aid that happens, and that's what a lot of people point to as the magic of those groups. So SMART, self-management, addiction recovery, was founded as an international nonprofit helping individuals and families with dependencies. It was originally formed in the 80s as something called rational recovery, kind of adjacent, or not adjacent, I would say a counterpoint, as it says right here on the slide, to AA. So an alternative option. And it was reformed to be Smart Recovery in '94. It's recognized by the American Academy of Family Physicians and NIDA, which is the National Institute on Drug Abuse, and the National Institute on Alcohol Abuse and Alcoholism, as a recognized treatment intervention. There are, as of 2017, there was 2,500 meetings and over 100 family meetings worldwide. Now, we don't know what COVID may have done to those numbers. I know that a lot of, in certain areas, certain resources may have dried up, or people moved to, web-based kind of groups. So we don't know exactly what those figures look like today, but as of 2017, it had a pretty good reach worldwide. But in comparison, there are 60,000 AA groups. That's just AA in the US alone. So definitely AA still has more reach, and for that reason is better known as a mutual aid group. Next slide, please. So you may be wondering what the difference is between a traditional 12-step program such as AA, NA, OA, and the list goes on, versus the SMART program. So let's take a look at that. One of the biggest distinguishing factors is that the 12-step programs frequently mention a higher power. In its 12 steps, there are 6 mentions of God, Him, or higher power. That is absent in Smart Recovery. Smart Recovery takes a more clinical, I don't want to say more, I think a more structured clinical approach than the 12-step group does, and leaves out mentions of spirituality and religion to that extent. In a 12-step group, there's an emphasis on surrender and a disease model. There's a requirement that you surrender and acknowledge the power of your dependency or addiction, which is the term that they use in the 12-step programs, over yourself. I don't know if anybody out there might be able to think about where some of the problems would be. Please start thinking about some of the I don't want to say hang-ups, but some of the barriers that this may put in place between a person and accessing this kind of recovery assistance or treatment. When you think about emphasizing surrender of oneself, think about the individual who may have been traumatized and asked to surrender, not given the choice about surrender, whether it be to an assault, being exploited, being victimized in a sexual, physical, or emotional way. This may be very difficult and re-traumatizing for some individuals. Not saying all. Again, 12-step fits for many people. It's a great fit. For others, this may not be as helpful. They do use sponsors, and I said, for those of you who are familiar, I think most folks are familiar with the role of sponsors in 12-step programs. It's really like a mentor and an individual who's kind of been there, done that, has a certain amount of time in recovery and in sobriety, and helps to mentor and model for kind of a newcomer to recovery. Individuals in 12-step programs are expected to identify as an alcoholic or addict. For those of us who are recovery oriented, this can rub folks the wrong way, right? So not very person-centered or person-first in terms of separating the individual from the illness or the disorder that they're currently coping with. And there is kind of a bottom line in 12-step programs, which is moderate use is a no-no. So there's not this harm reduction model as much as it is expected that individuals will be abstinent, 100% abstinent. Of course, people are welcome back when they have a relapse, and individuals are not excluded from that group, but the expectation is that individuals are working towards complete abstinence from their either behavior or substance of addiction or dependency. SMART, on the other hand, doesn't have 12 steps. It's essentially a 4-point program, which focuses on these core areas of building motivation, coping with urges, problem solving, and lifestyle balance. So when I referenced some of its similarities to IMR, for any of you who may be familiar with IMR, you could see that like these are some similar themes that come up in IMR, and understanding that IMR is about building an individual's understanding of the condition that they're living with, recognizing where their strengths are, how they can capitalize on their strengths, kind of getting back to their valued life roles or social roles and those values that they hold in esteem for themselves, and figuring out how to live with this condition and move along the path of recovery. Very different from this 12-step model in that sense. And there's no stance on moderate use. Doesn't advocate for harm reduction, doesn't advocate for, using substances or engaging in these problematic or pathological behaviors. It doesn't advocate for that, but it doesn't take a hard line on it. Also knowing that everybody's path to recovery is individualized, and not wanting to kind of push people out of the fold who aren't quite there yet, right? When we talk about the behavioral change process in almost any behavioral change, health change, whether it be reducing substance use, or whether it be losing weight or quitting smoking, or maybe starting an exercise routine. We need to meet people where they are, and our jobs as clinicians are to help find those things that are going to motivate them along the way. So that's where motivational interviewing, if you've attended any of our webinars on that topic, fits hand in hand really well with SMART recovery. Next slide, please. So let's review. This is just kind of further illustrating where we see that idea of God or spirituality or him, his, and also very patriarchal. The 12 steps of Alcoholics Anonymous, you see in most of the steps mention this reference to God or spirituality. So this is just to kind of illustrate this. A power greater than ourselves could restore us to sanity. That really puts an individual in kind of a passive role, right? And we want folks, and the idea of SMART recovery is to empower people. This may be motivating to some, but for those who it doesn't work for, there is this alternative that is a bit more person-centered and empowering. Next slide, please.
So before we go on, I just want to ask, why do you think that some people might find it difficult to engage with a treatment that is spiritually rooted or expects you to have a relationship with a higher power? Does anybody have any thoughts on that? You can type it in the chat box.
Yeah, and I don't want people to think that I'm beating up on religion or spirituality. I consider myself a very spiritual person who happens to not be religious. But I myself, I have this concept of a universal power. Sometimes I call it God, sometimes I call it the universe, sometimes I call it the energy. I don't have a problem. But again, like for someone like me, like this might not be a good fit, right? Because it's a little bit prescriptive in terms of forcing an individual to kind of align with religious beliefs in their recovery. Does anybody have thoughts on that?
And while we know that, a person's faith could be a really huge component of their recovery, and that might be a really great thing for them, and that's something that they identify with.
Mhm.
Um, but for others, it may not feel that same way. A response that came in the chat box: some people identify their deity as female or
Yeah,
ungendered.
absolutely.
Yeah, so having something that says he, him, might be a little off-putting for.
Folks may have belief systems that in which there are multiple deities, right? Um, and so this idea of being culturally competent also comes into play, I think.
Then Tony said, "I have a strong faith, but it's my personal journey." Yeah, so I mean that's we for people who are in AA or OA or any kind of 12-step program, it's a very universal kind of blanket statement, and not everybody has the same experience with that.
I like what Jackie said.
Yeah.
Yeah, and I've heard folks say that before, right? You can identify it as anything. Um, I don't know if that makes it helpful or not, even if you are religious and, faithful.
That's right. For AA, like it doesn't necessarily have to be a god or the like Jackie said, the higher power could be a doorknob, and really it's just like something other than myself that I have to give into,
Yeah.
give
And
over to.
and that idea of relinquishing power, again, it's very much related to this discussion of the higher power. Relinquishing power for someone who may have been maybe in recovery from trauma or maybe living with a trauma condition, someone who has had to relinquish their power has not been given the choice about relinquishing their power on one or multiple occasions, which tends to be for individuals who have dependencies, whether they're process dependencies or substance dependencies, um, you know, are more likely to have been traumatized and traumatized multiple times. So, we really have to think about and ask people, like, what do you think the fit's going to be for you? If they were very deeply rooted in religion and this concept of God, then 12 steps might be a great approach.
Yeah, and Jackie just asked a question, what does so does a Christian fit in and are welcomed by Smart Recovery? Yes,
Yes,
absolutely. And
absolutely.
that's kind of like the beauty of Smart, is that you could do AA if that's a good fit for you. You could also do Smart, or you could do both.
Yeah.
So it's not that you're someone who does believe in God or religion or has that spiritual component isn't welcome. It's just not focused upon as the main tenet of the group.
Right. And when we go through some of the worksheets and exercises, Jen's going to show us some of them later on. You'll see that there's one form called a hierarchy of values form. And I'm not going to get too much into it, but it asks you to identify those things that you hold in esteem, you place a lot of value on in your life. So perhaps for the individual who is very spiritual and religiously oriented and faithful, they may list their faith as one of those values, and we'll look at how then they can kind of examine that and look at, am I happy with that area of my life right now? Is there more that I want to do around this area of life to shore that up? So it will not be ignored if that is something that the person values. Thank you. Okay, next slide, please.
Coming.
It's okay, I see you multitasking. So as I briefly stated earlier, SMART operates on a basically a 4.4 prong system. It sounds like when I first looked at it, I'm like, oh, 4 points. So people are like awarded points for things. No, it just really means there's these 4 kind of arms within the structure that make up the structure of the program. So also within these points, the program offers these specific tools and techniques that you can be utilized within, that can be utilized within each of those kind of arms. So the first point is to build and maintain motivation. That kind of makes sense, right? You have somebody who either is recognizing that they have an issue with a substance or a behavior, or perhaps they don't, and they're being told that they do, and they're entering this this program. So we really want to understand, like, where are they in terms of their readiness to change? Is this something that's on their radar? We're hoping that they're at least in the contemplation stage, that this issue is causing problems that others are seeing, and hopefully they're seeing it too, and hopefully they want to see their life or recognize their life at some point without this problem. It's not always the case though. So, you know, people come in at different levels of readiness to change. We're all at different levels of readiness to change about a variety of things in our life. I drink a lot of caffeinated beverages. I also happen to smoke cigarettes, unfortunately. And I'm at different stages in terms of cutting one down versus the other. I'll let you guess, but you know, so we can be in different places around different things. And so it's especially important that if an individual is dealing with multiple dependencies, that you kind of tease out where the individual is around each of those. And again, we're going to look at some tools for doing that. Coping with urges is the second point. So, you know, helping individuals build up their toolkit or their toolbox of coping skills and activities that they can engage in when they're starting to recognize some of the early warning signs that precedes either using a substance or engaging in a problematic behavior. And so the worksheets and the tasks within this point are designed to help people develop or recognize early warning signs, and also develop alternative things, alternative activities that they can engage in to hopefully delay or prevent engaging in use of the substances or problematic behavior. Point 3 focuses on managing an individual's thoughts, feelings, and behaviors, and is really heavy and reliant on cognitive behavioral theory. So, you know, this is that idea that our thoughts influence our feelings. So how we think about something influences how we feel and how we feel about that thing in general, and maybe can also generalize our entire mood for the day sometimes, right? And those feelings can influence our behaviors, which also in turn can influence our thoughts, right? So if we're feeling like stressed out, and if our go-to has been, you know, mine used to, we were actually talking about it in our team meeting this morning, that one of my coworkers and I, who used to share an office, if we had a very stressful day at the hospital, we would kind of look at each other and know this is a Mexican restaurant, and specifically nacho day. We're having shrimp nachos. That's what's happening. Acapulco nachos, they were called. Like, really stressed out, need something to soothe me and make me feel better because I'm not going to be able to get through this day, right? So the feeling is like stress, and, you know, and then the behavior, I'm going to go and eat this entire plate of nachos. And then afterwards, guess what? I don't feel better. I feel guilty. Not always, but if you follow that line of reasoning, right? And then that feeling of guilt, you know, and thinking, wow, I gave in to my addiction again. I shouldn't have done that. I should have eaten better. I'm a failure at this. I'm never going to lose weight, leads me to feeling guilty and helpless, right? And then that feeds into the behaviors. And I may just go back and pick up nachos on the way home now because I just blew it, right, for the day. So,
Dawn, before you move on, there was two comments that came up in the chat that I thought were we should talk about a little bit. One, Jackie was talking about how she actually likes the idea of keeping her relationship with God separate from her work on recovery. Like it's like separate things. And then a question, Janae said she's curious if the lack of faith-based recovery allows for longer-term trauma healing versus replacing one addiction, the substances, with another, the religious zeal.
So
such an interesting phenomenon that happens.
And I think a lot of us know people, maybe related to people, may have worked with people, whether it be a client kind of clinician relationship, that have been involved with 12-step programs, who it becomes their world, right? And I'm not saying that's a bad thing, but this idea that one thing shouldn't be our coping skill for everything is something that really, we need to think about thoughtfully. AA obviously works well for a lot of people, but we have to be careful in replacing one, I'm going to dive into this head first, and this is going to be the answer to all of my stressors and bad days and problems in my relationships, whether that be religion or a group that focuses on religion or an activity, then having this kind of more balanced set of tools to work with. So yeah, I think you articulated that very well. Thank you. Oh, and point 4, I almost left that part out.
Oh, sorry,
Jen. Living a balanced life. So, this 4-point system recognizes that wellness is important to keeping us, abstinent from the behaviors. And when I say behaviors, I mean, also, using substances or other behaviors, abstinent from the behaviors that are going to cause us harm. Wellness is a huge part of that, right? Because we need to have areas in our life that shore up those areas or counter those areas that are a little bit more stressful, and where there may be some cracks in the flooring, right? So, or in the structure. So there is this emphasis, apparently too much Coke Zero today because I'm tripping over myself. There is an emphasis on, developing a well-balanced life of wellness. Next slide, please. Okay, excuse me. So as I mentioned when I kind of introduced this, smart recovery in and of itself isn't necessarily the intervention. So it's a kind of a package of interventions or prongs that we utilize. So some of the components that are used within the group are, as I said before, it's rooted in cognitive behavioral theory or therapy. So clinicians are expected to use, these activities that help people identify their thoughts about the behavior that they're engaging in, or stressor that they're facing, their feelings around it, and the related behaviors. And in psych rehab, we kind of dub this catch it, check it, change it. So catching the thought, checking the thought against evidence. I'm a terrible person, I'm a failure, these kind of negatives, I can't do this. Checking it against evidence. I'm not a failure, I've succeeded at things before that are similar to this. I could probably do this, right? And change it, to change that thought to something that's more, self-serving rather than self-defeating. Rational emotive behavior therapy, which is similar to cognitive behavior therapy. This is my favorite theorist, Albert Ellis's approach. And rational emotive behavior therapy is a little bit more challenging and confrontational than cognitive behavioral therapy, but similar. Brings in kind of the emotion part that some of CBT leaves out a little bit. Stages of change, which we've done several webinars on this. So stages of change looks at, where the person is in their readiness to make a change in their lives. And so they go through several stages: pre-contemplation, contemplation, preparation, action, maintenance. Sometimes we add relapse onto that, but that's not always in the model. Understanding where people are in those stages for a particular behavior is essential. Motivational interviewing goes hand in hand with stages of change. Once we know where an individual is in their readiness to change, Then we utilize motivational interviewing techniques, which we'll touch on very briefly, to help move a person along. And a lot of what we do here is highlighting discrepancies. Person says they want X goal in their life, but the current behavior is keeping them from that goal. What can we do to help you move along, right? But it's very much person-directed, self-directed, I should say. There's a bevy of worksheets and tools, and I will say that all of these worksheets and tools that we're going to show you are available to you today and are free. So you can access them. In terms of things like manuals and the like, I believe you have to purchase them. But Jen just dropped the link to Smart Recovery in the chat, so I know everybody's going to go there right now, and that's okay. But these tools and resources are available to you, so I'd say download them if you can. The group is structured similar to AA in terms of how the facilitation happens. Family and friends are invited. They are included, as with other psychoeducational groups. We recognize how important significant others can be in an individual's life. That doesn't just mean blood family, but it may be family of choice and other individuals that are supports in the person's social network. And the goals are SMART. So SMART has a double meaning when it comes to smart recovery, in that any goals that are established or set forth should be specific, measurable, agreeable, right? They're the person's goals, not yours. Realistic, they're, achievable, and time bound. So this isn't going to drag on forever. There is an expected, date of completion, or at least there are milestones set forth. Next slide.
Trying to find it. My little arrow disappears if
Mine does too.
Too long, and then I can't find it. So, all right. So I want to open it up for a minute. Based on what you've learned so far, what do you think some of the benefits of using Smart Recovery versus a 12-step program might be? And as you're thinking about that, you can put your answer in the chat box, or you can raise your hand if you want to talk, and we can unmute you. And then we're going to talk about the structure of the group and show you some of the forms that are used. But what are your thoughts so far, and what the benefits could be using the Smart Recovery approach versus a 12-step? And remember, we're not saying one is mutually exclusively better than another, and you can use both together. But what do you think some benefits might be? Vernalisa, I see your hand raised, so I'm going to unmute you. You are ready to go. You can speak. Let's see if we can hear you.
While she's trying, I'm going to mention some of the comments that I see in the chat. Tony was saying it would be a great group class for work in a co-occurring facility. I think that's absolutely. Valerie said, can we talk a little bit about where mindfulness practices might fit into this model? So I believe that when we talk about balanced lifestyle, that's where we're able to kind of identify practices that may help the individual in their stress management and other things that might be addressed by mindfulness practice. I am not sure if it is incorporated specifically as an activity in Smart Recovery. I don't think it would be exclusionary, though.
Also, you can do this kind of program in areas like this is run in state hospitals in New Jersey, and it's an alternative to AA because people can't get out to a community group. Often there's AA or NA groups that are brought into the hospital, but it gives people choices, right? So if they can't go out to the community and go to an AA group there, they can do a smart recovery group. So it might be more versatile in terms of like where it could happen as well.
Mhm. Janelle said that they like the cognitive skill building that could be used in and out of recovery. Yeah, absolutely. And, not only when you see some of these forms, we think you'll see that you can use some of these forms unrelated to a substance or a process dependency, right? There are some of these forms that can just be used to help kind of tease out somebody's thought processes and motivation around a specific change they want to see. Janae said they like the structured time frame. It seems like it would give an appropriate push so people don't feel stagnant. Yeah, right. So it kind of sets a framework for folks where that may not be as clear in the 12-step process, although the 12 steps does, it does kind of provide a framework, but people sometimes struggle with following it sequentially.
And the inclusion of family and friends,
Mhm.
where it's within the same model instead of AA versus Al-Anon. So if you're a family member, you would go to Al-Anon. If you're the AA attendee, then your family doesn't usually come
Right.
with you.
I think it's only if
So
it's an open group.
right, right. So this is a way to have it be inclusive and, as Nettie just said, non-alienating, and it could be applied to different ages, different cultures, and it might have a more inclusive feel.
Mhm. Oh, Jackie, that's great to hear. And congratulations on the 4 years. But yeah,
Someone else
so
earlier said they had 22, which is
that's
amazing.
amazing. Well, congratulations. Oh my gosh, I didn't see that.
Yeah.
That's amazing. Um, yeah, right. Sometimes what worked for us at one point, we change as people over time, right? We change, we evolve, we our beliefs move around all over the place. I've danced with the God concept multiple times in my life. And so like what maybe worked for us at one point maybe doesn't anymore. Maybe we try something else or use it as an adjunct. So yeah,
I like the what Jackie said about being a more holistic approach. And like Dawn said, like you change. And so what worked in, 5 years ago may not work quite as well now, or maybe you supplement it with other things. And like Dawn said, when you see the forms that I'm going to show you in a minute, you'll see really how applicable they could be to not just a substance dependency, or just even about making a change in your life, goal setting. So they really can be used in multiple ways. So even if you're continuing on your AA journey, but want to supplement with some of these techniques and activities that may, ignite you again, that may reignite some of that, recovery spark, that could be done too. So it's really just about kind of figuring out what works for you.
and one
Funny story, last night I was telling my husband that I was going to be, on this webinar today and talking about smart recovery as an alternate to AA. And he goes, "What? It's not an alternate. It's not an alternate. Don't teach people that." I'm like, no, 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 no. I don't mean like in place of, like, you shouldn't use AA. I'm saying it's another resource for people to use. So whether it's in place of, or whether it's Dawn, can you post
Yep,
the
absolutely. I'm going to put it in right now.
whether it's in place of, or whether it's both, or whether it's, I want to do AA and then supplement with some of the activities and forms and, components of the smart recovery that actually work for me. That's great. But he was like, "Don't tell people that you should do this." I'm like, "I'm not telling people anything." But, people have some very strong opinions about one thing or another, and especially if it's what you know and what you've done. So having at least some exposure to other resources, I think, is really helpful.
Right. And it's all about choice, right? I mean, we know in the mental health system and in the uh, addictions medicine kind of system of care, there aren't enough choices. So wherever we can provide a choice for an individual or an option, we want to try to do that.
Right.
Okay.
Hi, I see your hand up, so I just unmuted you, and feel free to to talk.
Thank you. What I was going to say piggies back perfectly on what you just said about giving individuals choice, and that is because I have heard so many different times, people say, I don't want to go to AA because I don't believe in God, or I don't believe in God the way they think that they should in order to participate in a program like that. Or in my own experience, my concept of God was one way as I grew up as a child. And then when I became an adult, I started to read more and I began to experience God in a different way. And so my concept of God changed significantly. And I just think that it's very important that people who aren't comfortable with that have an option that they can follow. So.
Exactly. That's exactly it. And even though the things that work for us might change, our beliefs might change, or some of our value systems might change as we get older or have more experience or whatever the case is. But to have at least options, right? That I think that's the key, and to give people the choice, and that's not the only route. And if that's the only route and it works for you, absolutely 1000% great. But there are other options for people who that might not be true for. Thank you for sharing that, Ty. All right, anybody else? I'm gonna move on and start showing you some of these great forms that you can use and incorporate into your practice. All right, I lost my arrow again. So, okay, so before we get into the forms, I want to talk about the structure of the group. A major component of Smart Recovery is in the meetings, whether they're face-to-face, whether they're online, is the consistency. And so Smart in the hospital looks a certain way. Smart in the community is a little bit more structured. There's they might have meeting review, homework, pre-meeting socialization. But in a controlled environment like the hospital, Smart Recovery has some barriers, and time is usually a factor. But in the community, any Smart Recovery group should have the following components. You always want to do a welcome and an introduction, just kind of to set the tone. And following the structure and having this consistency in the group really helps eliminate some of the anxiety about like what happens in the group. If it's done the same way, the group participants know exactly what to expect, how long things are going to take. So a typical Smart Recovery group might take about 90 minutes. And again, if you're doing it in a more structured or controlled environment, like an agency, a program, or an inpatient setting, you might have to adjust the time. But typically, if you're looking at a community group, we're looking at about 90 minutes. So you do the welcome and introduction. You would introduce any new people in this time. You would do a quick check-in. What the heck? I'm so sorry. I gotta stop using my mouse. You would do a quick check-in, introduce anybody new, and normally you would do it in a round. So I might say, okay, we're just gonna, kind of go around and check in on everybody and see how we're doing, see how you're doing this week. And once you're part of the group a couple of times, you kind of expect that that's what's going to happen, that everyone's going to go around and say something. So as a facilitator, I might say, okay, we're going to go around and check in with everybody. How was the week? Anything, good happen? Any progress? And Dawn, we're going to start with you. How about we start with you? How was your week this week? Or can you check in and let us know how you're doing? And so Dawn would start, and then it would just go around from person to person. And then the next part of the group is just kind of setting the agenda. So in today's group, we're going to be talking about goal setting. And this is everybody's going to have an opportunity to think about something that they want to change in their life this week. And then the working time, about 40 to 50 minutes, is really the bulk of the group. And that's either teaching something. It could be reading something from the manual and having a discussion about it. It could be working on some of the forms, depending where you are in the group. So it could be, that's like your teaching time. So whether you're actually like teaching a skill or talking about, check it, catch it, check it, change it. If you're doing a pros and cons list, if you're doing one of the worksheets, that's the time that would happen. And then pass the hat in the community. This is where a donation is taken. And then you would do a final like checkout or closing. And both the check-in and the checkout are really important parts of the group, because it's really like the structured time for the participant in the group to be able to talk and to share and to, have that structured time. So again, you would do it in a round. You would maybe call on that first person, the first individual to start speaking, and then the expectation is that everyone would go around and say something. And of course, everyone has the opportunity to pass if they don't want to share. Dawn.
Yes, I just wanted to say something about pass the hat. So pass the hat is this idea that in these mutual aid self-help groups, very often the groups are supported financially by the group members. So this is definitely a component of 12-step groups. For all groups, this is voluntary, whether a person chooses to donate or not. And I would suggest that you use your discretion in terms of whether or not this is going to be a component of your SMART format, depending on the population that you're working with, right? If you're working with individuals who are literally homeless, I'm not sure we want to ask them for a donation. There may be other ways that individuals can contribute to the operation of the group, like helping to put the chairs out, or helping kind of like organize the room, or whatever it may be, that approximates that activity of giving back, right, to the group. So I just wanted to give my 2 cents or opinions on that.
Thanks so much. All right, so let's take a look at what some of the tools look like. And here's another link. This you can get here from the link that we posted before, but this is a link directly to the toolbox in Smart Recovery. And all of these forms that I have listed here are on there. It gives a full description about the form, how to use it. You can download it, and they are free and publicly accessible to all. So feel free to explore them, but I'm going to give you a brief overview. This is just an overview of the forms and what an example of how to use those forms. And you'll see that, as Dawn mentioned earlier, that these can be used in a variety of different ways outside of SMART if you wanted to. And you'll see as we go through. So I'm just going to switch my screen a little bit here and just make sure that this is correct. Dawn, can you see the right thing?
Yes.
Okay, cool. Okay, so I'm going to give you, sorry. Okay, so I'm going to give you an idea of what some of the forms look like. So that list that was on the last slide, we're going to show you. The first one is an ABCDE worksheet. And ABCDE stands for activating event, belief, consequence, dispute, and effective change. And this is really about what we were talking about earlier, about the kind of the catch it, check it, change it concept. So maybe you have an, did you see that when I enlarged it, Dawn?
Yep, it's bigger now.
Okay, thanks. I just want to make sure my screen is working the right way. So you might have an activating event, like I had an argument with my wife or husband, and the belief about that tends to be irrational. Like, this is too much for me. My marriage is over. I'm never going to be able to cope with this. I'm going to need to drink or use substances in order to be able to handle this. That's my irrational thought. So what's going to happen? What's the consequence of that irrational belief? I might say dumb things. I might drink too much to calm down. I know that my drinking might create more problems, and then this will set up the next fight with my wife. So what do I do to check it?
So
how
there is a meeting
dispute
threshold.
it in-
Wanted to do that one-on-one.
All right, let's mute
Oh,
Scott
sure.
again. Sorry. So disputing that, checking that irrational belief, like, you know what, we've been through this before. We get through it. My marriage is struggling, and I know drinking makes it worse, but it's still going, right? So this is like disputing that, checking that irrational thought. And then what is the E? What's the effective change? What do I do differently? And how do I think about it in a different way? So maybe it's, I can handle this without drinking, or, you know, we've been through worse than this, and we're going to make it through anyway, or there's better ways to deal with this stress. So this is the ABCD form. So activating event, belief, your irrational belief, the consequence of that belief, dispute it, and then the effective change. It also shows that they can modify those irrational beliefs and be more effective and adaptive to minimize some of those consequences. All right, so that's form 1. Form 2 is a change plan worksheet. And the purpose of this form is to create a change plan specific to a specific problematic behavior, and talk about perceived importance of the change, the confidence in your change, as well as supports and some barriers. And as we go through these, you're going to see a lot of those components that Dawn talked about earlier, the cognitive behavioral component, and the motivational interviewing components, and the stages of change components. So you'll see, you know, some of those kinds of things sprinkled throughout. So let me just make this bigger so you can see it a little bit clearer. So for this example, maybe the change that the person wants to make is to stop drinking. So then it goes through, how important is it to make that change? A 9, that's pretty important, right? How confident am I that I can make this change? A 4. So right there, that gives you some like, I'm ready. It gives you a lot of information. I'm ready the person's ready to change, but I'm not really sure that I can do it, whether it's because of my skill set, my motivation, you know, my ability to control urges, like what's my other coping skills that I can use in place of using this, doing this behavior. So then you go through and say, whoops, why? Why do you want to make the change? That's very motivational interviewing based, right? Why is it important? How would my life be better if I made those changes? What are some steps that I could use in making that change? How can other people help me? So like, what plan can I put in place for other people to support me? How will I know when I get there? How do I know my plan is working? And then what are some barriers that would stop me from making this change? And so this particular form is one of those examples of how you can use this for any kind of, like, before you get to a major goal setting worksheet or a goal setting form. What are some changes that you want to make in your life? And we do this a lot in IMR too. You know, when we talk about goal setting, we talk about like, how would my life be better if I did that goal? Or how would my life be better if I made that change? What kinds of things how would that benefit me? What would be better from that? So it's just sometimes when I know from doing illness management recovery, IMR, sometimes when we ask people, what are your goals? You know, that could be really overwhelming. And as Dawn mentioned before, sometimes you're ready to make a change in one area of your life, but maybe not so ready in another, or to make a change in another area. So maybe you want to cut down on the coffee, but not ready to, you know, make a change somewhere else. So it's really helpful before you get to the big goal setting part to like start thinking about the changes that you want to make in your life, how important they are to you, how confident you feel, supports, and some of the barriers that might get in the way. And then form 3, you may have seen something like this before. It's kind of like an advanced pro-con list. Yeah, IMR is illness management and recovery. And that's a program that we use to help people gain kind of an understanding of their mental health condition, gain mastery over it, set goals in their life that are meaningful, that they want to do, and then provide the skills and supports to do that. Thanks, Dawn. So back to this one, the cost benefit analysis worksheet, or a CBA worksheet, is like an advanced version of pros and cons. In IMR, we might call it, or motivational interviewing, we might call it a payoff matrix. So you look at like, what are the pros and cons of stopping or not stopping a particular behavior? So maybe what are the benefits to using alcohol? So this box would be, what are the benefits of using alcohol? The person might say, it makes me feel better. I talk to other people. It ends the fight for now. What are the costs or the risks or disadvantages of using alcohol? My wife gets mad. I spend more money. I lost my license. I drive drunk. It gives me health conditions. And then you say, what are the benefits of not using alcohol? And so it might be things like, well, there'd be less to fight about. I'd have more money. My wife would be happier. I'd be healthier, kind of like the opposite of that, of this box here. And then what are the risks or costs of not using alcohol? Well, I don't know how to deal with stress then, or I'd get out less, or my social life would change, or my friends would change. So the important part about this form, and this is something that is used in a variety of different programs. So it's not, this one is not only in Smart Recovery. You know, a pro-con list could be used in a lot of things, but the key is that what we think the costs and benefits, or the pros and cons of using, not using, would be for that person might not be the same thing that they come up with. And the thing that they come up with might be more important. They might put more importance in one of these boxes than we would think. So maybe for this person, you know, it's about having that social component, and without drinking, they wouldn't have that social component. Maybe that's really important to them, where we might think as the facilitator, you know what, like your marriage is really important and your health is really important. That might not come into play for that person. So it's really important. This is a really important exercise to do with anybody. And again, not just in Smart Recovery, but anyone wanting to make a change, because what we think the benefits might be for the person making the change may not be what they are thinking. So this is a really great way to kind of tease out those pros and cons for that person. The next form is called a DEEDS worksheet, and that stands for deny or delay, escape, avoid, distract, and substitute. And these are all strategies for coping with urges to engage in the behavior that you're trying to not do by using alternative thoughts and behaviors. So I'm going to make that bigger. So basically the DEEDS, or DEADS, I don't know, I guess I would pronounce it DEADS, but it's DEADS. So how long do the urges last? And it's really about the person kind of journaling and exploring what those urges look like for them. So how long do the urges last if you don't give in? How bad do they get before fading? Like, let's talk about what that actually looks like for you. And then the E would be escape. What triggers can you get away from? You know, in AA, NA, OA, it's always about, you know, people, places, things being the triggers. So what are those triggers that you can avoid? What are the things that you can stay away from? For some people, you can't avoid, like, how are you going to avoid your wife? You know, like, but what are the things that you could do to kind of escape for even a temporary time, to escape the influence of that trigger? And then A is the avoid, accept, or attack. So what can you do to avoid the urges? What techniques or strategies or coping skills helped you kind of sit with that urge and kind of wait it out until it passes without giving in? Like, what are some things that you've done? what tools or words can you use to attack the urge? So you can tell them like, you know what, you're not going to get me this time. You know, I am not going to give in to you. I can take the dog for a walk. I can burn off energy. I can, you know, I can talk to myself and tell myself positive things and the things that the consequences that would happen if I gave into those urges. And then distract yourself with an activity. What activities have you considered or written down or done that takes your mind off the urge? What do you do to fill the time that you used to spend on the addictive behavior? Talking to family and friends instead of strangers in a bar, walking the dog, doing projects. What are some of those things? And then S is the substitute for addictive thinking. So what thoughts can or have you developed to dispute, right? Check it, change it, that irrational or illogical thinking that comes with urges. And what healthy activities can you do to replace when you're that thinking and feeling? So maybe it's, you know, exercise is better than drinking, talk to people instead of drinking. Every fight doesn't mean divorce. So it's a way for folks to kind of explore some of these things. Sometimes when things are written out, like in a journal or a form, it might even be helpful for that person to have that written down. So when they get that urge, they can whip out their form and be like, okay, I feel really miserable right now. What did I say helps? Because when the feeling comes to want to do that negative behavior, maybe you're not thinking as clearly as you would. So having something written down can be helpful in those situations. The next form is DIBS, and that stands for disputing irrational beliefs. This worksheet prompts a person to list those beliefs that contribute to the target behavior and develop healthier alternative techniques or beliefs. So again, that check it, catch it, check it, change it, same kind of thing. Like, what's the irrational thought? What's the thought that I need to check or catch and then check? Like, is that really helping? What's the rational belief? What's the change it thought? Drinking makes it worse. So if my irrational belief is drinking helps, I'm gonna check it. How is it helping? It's not. And then the rational belief is drinking actually worsens it. So just another way to kind of catch it, check it, change it. And then disarm stands for destructive images and self-talk awareness and refusal model. Now, again, this is just an overview, and I don't expect anyone to like remember this. You have the whole toolbox that you can go to. But this worksheet encourages the person to create a nickname for their urges so that they can identify it when it first shows up and deal with it more effectively. So it's giving your urge a name or a voice, kind of like puts you in control, right? It doesn't, it kind of gives you the power back over the urge instead of the urge taking over you. An urge is merely a feeling or an impulse that you experience. It doesn't define you. Your addiction doesn't define you. Your dependency doesn't define you. Your problem behavior doesn't define you. So this is a way for you to say that your urge doesn't define you either. And it's a way to kind of take back that power over that urge and kind of like depersonalize it. And then you get into goal setting. And this is pretty much a standard goal setting worksheet. And you can use this in a variety of different ways too, not just in Smart Recovery. So, you know, what's the category that we're working on? And remember, you can set goals in different areas of your life. You maybe have in a stage of readiness in one area of your life and not so much in another. So figuring out like where in your life balance pie that we'll talk about, what category are we talking about? So maybe this one is stress, and related to value. We're going to talk about the values one on the next slide. but I'm good at dealing with stress. And my goal then is to stop using alcohol as a stress reliever for my marital problems. So then, is the goal a SMART goal? Is it specific, measurable, agreeable, realistic, or time bound? So the revised goal might be, I'm not going to drink for the next 30 days. And then what are some tasks or objectives to reach that goal? I'm going to walk the dog. I'm going to call for support. I'm going to do all my worksheets, and I'm going to attend a meeting. So this is a way to do a very realistic, short-term, specific and measurable goal. And the HOV worksheet, this is called the hierarchy of values worksheet. And this prompts the person to write down kind of like the things that the values that they prioritize in their life. With the idea of showing where and how their target behavior kind of clashes with those values. So let me show you an example. On this lifestyle balance pie, the person listed down here the 5, well, they did it in the last one. They list the 5 things that they prioritize, the 5 values they prioritize. So we know that this person's been talking about their marriage all throughout, being financially stable, good physical health, supportive relationships, and stress. So on the pie, they list out the things that were important for them, and then they plot those numbers. So stress was a 3, that was pretty low. Marriage was a 4, that's over here. Family relationships were an 8, that's high. Anyway, it's just another way to kind of visually represent the things that are important to them, the areas where they might need to focus on, and where they can focus on making those changes. So if your stress level is a 3, that's pretty low. Like maybe you want to focus more something up here. So this isn't, this graph isn't an exact science. It's just a way to visualize and, visually represent the areas that you might want to work on. And then Form 10 is an urge log. And this is just kind of like a diary, like a journal, where a person can document every time they have an urge and what they did to fight the urge, what worked, what didn't work, and then see if there's any patterns. Even just the writing down of like, what, every night at 6 o'clock, I get home from work, I get into a fight with my wife. Like that might, the person might actually start seeing a pattern developing there. So it's just a way to track and keep track of when it comes, what you did, what was helpful, what wasn't helpful, and then seeing if there's any patterns that you could break. And then the last form is called the Vital Absorbing Creative Interest Worksheet. And this is talking about things that you used to do that were helpful or that were interesting or that you enjoyed. And it's about reclaiming those parts of your life that you used to do before whatever problem it is that you're dealing with now. So what are some things that you did, and how much did you enjoy it? How much did it interest you before you had this problem? And where are you at now? And then any thoughts. And so it's just about talking about like, well, here I am in this situation. Like, what are some things that I did before I had a drinking problem? What are some things that I enjoyed before I went to a bar every night? And how do I get back there? Bye, Catherine. Thank you for coming. So those are the forms, and these forms could either be done in group during that work period, or they could be given for homework and then discussed in the group during that work period. So we always suggest anyway that before you use these forms on, with your with your clients or people in your agency, like print them out, do a couple yourself. It could be like, my goal is to, or my change behavior is like, I want to move, or I want a new job, or I want to go back to school. Like, it doesn't have to be necessarily addiction related or dependency related, but just to get an idea of how it feels to fill those forms out. Obviously, like the urge forms might not be applicable, but it kind of gives you an idea of what kinds of things that you're going to be asking for of the participants using the form. So we think it's really helpful. I'm going to switch screens and go back to the PowerPoint. Let me just make sure I can do that smoothly. Okay. All right. So again, all of these forms are available in that in the Smart Recovery Toolbox, and you can download them, you can use them. And so some recommendations that we have for using the SMART program is, number one, to maintain fidelity to the SMART program. So with any program that has a structure, the closer you stick to the recipe of the fidelity of that program, the better product you're going to get. So if you think of using a program as like a recipe, like if you substitute a cup of flour for a cup of sugar, you're going to have a very different product at the end. So we want to try to keep the consistency of the program as close to the model as it can, and adjust the material appropriately for the population. So if you're in the hospital, or doing it in an inpatient setting, you might want to break the topics down and chunk them a little smaller. You might need to adjust your time a little bit because of the time constrictions that you would have in an inpatient setting. And then finally, like, give people choices. That we've been talking about this throughout the presentation. So it could be a 12-step program, it could be Smart Recovery, it could be both, right? So using the components that work and the program that works for them. Anyone being forced to participate in any or either or all of them is probably not the best approach, right? As we know. And then advocate and educate others about SMART programs. So family, the correction population, using online groups and resources in that toolbox, and then encourage people with process dependencies to attend as well. So it doesn't just have to be drugs, alcohol, substances. It could be process dependencies too. So do we have a minute, Dawn, to open it up for discussion?
We have 9 minutes.
Oh, okay. Yes, we do. Okay, great. So that's all we have to present for you. What did you think? What do you think about Smart Recovery if you haven't mentioned anything in the chat yet? Or now that you've seen the forms, do you find that they might be helpful? What's the next step to getting training to be able to facilitate a group at my work? Well, we have a Smart Recovery training available. Well, it'll be available maybe in a week or so, but you can go on the Smart Recovery website, and I don't know that you have to be, a certified SMART facilitator. So, and so you would really just need to learn more about it. Our training will be available in the next couple of weeks on getting a little bit more in depth. But you don't need any special.
I'm going to put our email addresses in the chat box, Tony, so that you or anybody else who might be, interested in receiving more formal training support around this can reach out to us. And then that'll, so if you send us that email, it'll like put it on our radar to talk to our team about that. So I'm going to put this information in the chat.
Also, I wanted to show you on, I know Dawn put our link to our website in the chat box, but under this section here where it says online trainings, this is an old picture, it doesn't really say that anymore. So I'm going to show you. If you go to our website that looks like this now, and this is going to change soon, but under under prep webinars, there's, if you go to May, there's another whole recorded training in Smart Recovery that you could watch. There it is. That you could watch the recording of. You can also go to our website, and I'll post the link for that. And any of the recordings that we have of webinars that we've done for, there's a whole lot of them. And I'm going to show you that. If you go to our YouTube channel, and I'm going to post the link as soon as it loads. Okay, so I cleared all my cookies this morning, and I'm not going to be signed into anything. Let's see if I could go right here. Sorry, guys, I have to go through my whole, no. Okay. This was a long, convoluted way. Jesus, yes, there's going to be a copy of the PowerPoint sent out, as well as a recording of the training. And this is our YouTube channel. I'm going to post it in the chat. And any of the recordings from prep webinars or trainings that we've done, these are all free and available to anyone. You can get more information on any of those topics there. You're welcome. I see the forms are positive, insightful worksheets to assist those desiring and understanding and change to behavior. Yeah, they're really good. And I hope you got a little bit of a sense of how those forms can be used in so many different ways and not just SMART. Go back to here. There's also some references here. You already know about smartrecovery.org, and there's a link to aa.org if you want more information there. And Tony, you can get the forms again by going to smartrecovery.org and then click on the toolbox. No space. www.smartrecovery.org. Click on toolbox. All the forms will be listed there. I'll just show you real quick what that looks like. So when you go to Smart Recovery, under resources, you would just click on toolbox. There you go. Yeah, thank you, Jackie. Yeah, so right under resources, the first thing is toolbox, and then all of the forms that I showed you are right here under participant toolbox. So if you go to like ABC tools, that's that ABCDE worksheet, and it gives you a description of the whole form. And then there's actually a video on each page that talks about how to use that form in a little bit more detail than we were able to give today. Then it also gives some examples. And then say I want to go back to the toolbox. So we have 2 minutes left. Say I want to go to the cost benefit analysis form. Here's the form that I showed you. Here's how to fill it out. Again, here's another video that teaches you how to do it and gives you some more detailed information. So there's a page of this for every form that we went over. So right in here, these yellow links bring you to each form, gives you a much fuller description, a video, examples. So you can really get a lot of information from this website. I mean, is the Smart Recovery website, but there's a lot of stuff here that, a lot of resources that we weren't really able to dive too deep into today because of our time. So this was an overview, and I hope you enjoyed it, and I hope you got some good information from it. And I just want to say thank you. I'm going to go back to that slide, and we appreciate your participation. And just as a reminder, today's webinar was brought to you and hosted through DBHR, through the Washington Healthcare Authority. And just as a reminder, the slides, the link to the recording, and other resources will be available after the presentation in a follow-up email. And don't forget to check out the Foundational Community Supports newsletter for all things FCS and upcoming training events. And if you'd like more information on becoming an FCS provider, please reach out to AmeriGroup at that number on the slides. And again, you're going to get these, so all of that information will be there. And I know Dawn put our information in the chat box, but here we are. It's our first name dot last name at rutgers.edu, and that's where you can find us. So thank you so much, everybody. And we're officially coming up on the end. So thanks for joining us today. We'll see you next time.
Have a wonderful week.
Bye, guys.
Bye. I'm moving over to my other meeting now.